friends, today the team integrated homeopathy has come to you with a very interesting remedy, another spider remedy, Latrodectus mactans. Now, we have already presented to you two more spiders earlier, the Theridion and Latrodectus Hasseltii. But today, Dr. Kushala Salian and Dr. Anita Bajaj are going to share their cases of Latrodectus mactans with us. As we all know that Latrodectus mactans is almost a specific remedy for the heart disease. But Dr. Kushala will share her case in which she has prescribed it in a small child, and we will learn that how she has reached and she has spotted this remedy in a small child by doing a methodical study. So I invite Dr. Kushala Salian to share her case. Yes, Dr. Kushala.
Thank you, Shobha. So, hello friends. Let's do another spider remedy, Latrodectus mactans, and let us study this case in detail. It's a case of a very young child. She's 3.5 years and she was studying in nursery. It's a small family of an elder brother who's 10 years, mother homemaker, father working. So they came to me saying since August 22, she's falling sick too often and she gets severe cough, that too early morning at 4 a.m., 5 a.m., as if some phlegm is stuck in the throat. And it's so disturbing cough that she would squeeze and cough intensely with full force. And also she would develop fever almost twice a month. Her stomach would be always bloated with gas. And this child would always say, my heart is paining, and show her chest. So the parents were actually very worried. So the mother gave the history. She said she has got a very baby nature with us. In school or mall, if she wants to go to the washroom, she will tell. She knows where to do things. At home, she knows that, she can do anything. So if she's alone at home with me, she will inform that I want to go to the washroom, because she knows I will shout and beat her if she does it in her pants. But this father never shouts or beats her, so she's very naughty with him. She'll not sit in one place. She'll be constantly roaming around, and she'll make him take her 10 times to the washroom, or she'll do in her pants. We have to still use Pampers for her outside. And she's very adamant about breastfeeding. Even at this age, every night she has to have breast. And if you refuse her, she'll cry so loudly in the middle of the night that you have to give her the breast milk. And she needs to hold the mother's breast while sleeping. So if she wants something her way, she will have it. If our way is forced on her, she will not do. What she wants, she will do. What she doesn't want, she will not do. She knows that breastfeeding is wrong, but she can't leave it. She's a very social child. She can talk to everyone. She's not scared with people. She'll answer back. In church, when we meet the priest, she will go to him. She'll say, Father, give me blessings. And she'll not sit in one place. She's restless. She'll go on moving and talking to everyone. She feels that children can do anything. But she's not friendly with everyone. Those whom she does not want to be friends with, she will not talk. She'll just wave. Her brother is more stable, but she knows where to do, where to be, how. She's not secure with outsiders, only with few. If she doesn't like someone, she will go away and she'll not mix. And also with Hindi-speaking kids of her age, she'll not speak to them or she'll not respond to them. And also she does not respond to the watchman of our society. Maybe he must have shouted at her or pulled her cheeks. In party, she's very bindas. She will go, she'll dance, she'll be friends with everyone. She's not scared. She's not shy. She's very alert. She's smart. She knows how to tackle things. She knows how to manage. She knows where to ask and whom to ask. Her brother is very simple. He's not street smart like her. She knows what she will get, when she will get, and from whom she will get. And she has quick answers. Like when we are going home, if we stop her, from going to the neighbor's house, she will immediately say, we must love our neighbors. We must keep good relation with them. So I'm going to say hello to them. Here she speaks as if like a big grown-up person. But at home, if she messes her toys on the floor, and if mother says you must clean your toys, she will immediately say, no, I'm small, let brother clean the mess. He should help me as he is older to me. So, wherever she wants to be big, she will talk like a big person. And wherever she wants to be small, she'll be like a small baby. So she has a lot of clarity of choice in clothes. She's headstrong. She's alert. She's chalak, who knows how to get things done, quick to answer. This chalak word mother used very often in the case. When guests come, she will come out, she'll say hello, she'll try to show them dance, she will impress them. Even the housemaid, before she leaves, she has to tell her bye. Out of the blue, she'll come to her, she'll, hug us, kiss us. She's very aggressive. She gets very angry if we talk about her outside. She'll bite and beat. When complain about her, she gets very embarrassed. When parents have arguments, she's like a referee. She'll say, no, you don't fight, make peace. Daddy, you say you love mommy, and she'll try to be like a referee and make them quiet. In class, she's quiet. Recently, she started roaming and interacting. She doesn't like to write. She'll not take efforts to write, but orally, she knows her work. She's sober in school. Few children are more naughty. They beat, push, break pencils. They're more street smart. She's scared to express about all this to her teacher because she feels teacher will shout at her. So in school, she's more sober. At home, she's always finding that there is someone, her father supports her, he pampers her. So at home, she's very naughty. Son older to her was very quiet, not naughty. When he was small, they were abroad. The parents were abroad. So mother was working and there was a maid to look after him. So the maid had disciplined him to time to eat, sleep. While when after her birth, the mother was more at home. So she gave her a lot of freedom to do things. So there was no timetable. She didn't discipline her. She has no fear of animals, insects. She hates mosquitoes. And she loves decorating house with small cards, like for mother's birthday, anyone's birthday. She'll make cards. She'll stick some, stickers on the wall. She's very creative, even of waste papers or of, waste medicine tablets. Those strips. She'll make some flower. She's very creative in that sense for her age. The way she cuts it into a small flower shape with a stem and leaf. She closes ears when there's a loud, unpleasant sound. She licks objects, just bedwetting at time. She's constipated. She passes every alternate day. She postpones to pass motion and then she passes in her pants. She has a lot of craving for fruits, dry fruits, oranges, carrots, cucumber, chocolate, eggs. And there's a lot of strong family history of heart disease in the maternal side of the family, the grandparents, the cousins, and father too had a myocardial infarct once. So this was an information which the mother gave very strongly. So what I found on analyzing this patient is there's a lot of attractive behavior. And she seeks attention. Like even when she came to the chambers for the first time, they said that she loves to dance and this and that. So I said, okay, let me see. I told her, show me one dance. And she immediately started dancing. So there's a lot of attractive behavior, attention seeking. She's very communicative. Manipulation and chalak came up many times with the mother's history. And she's very oversensitive to loud noise. She'll close her ears. There's fearfulness and a lot of nerve sensitivity, where she was complaining, my heart is spinning, but when on checkup, I did not find anything pathological, but this one symptom she gave very repeatedly and for a very long time. So I found that this case fits into the animal kingdom, especially the invertebrates. So in invertebrates, where would I place this? You see a lot of freedom. She needs her pace. She's very restless. She's creative. And she's clear. I want this dress. For her age, she only buys her dress for Christmas. She'll say, I want this dress, this pattern, and she'll buy. So there is a clarity of thoughts and ideas. and she's very friendly. She's communicative. So I know that this falls more into the aerial aspect of the invertebrate chart, of the animal chart. And where in the aerial, you see a lot of activity. She's very restless. She doesn't sit in one place. Even in the church, she'll be roaming all over. She's very energetic. She loves music, party, dancing. She's creative. She's very attention seeking. She knows how to grab her attention and, be in the limelight. She's intelligent. She's unrestrictive. You can't restrict her at all. The brother is the opposite. She's active. She loves to enjoy. She's social. She's an extrovert. So I think she falls in the spider. So I opened up the animal chart. So I said, okay, if this is where she, falls into, so where can we place her? So she's behaving like a baby. There is issues of, breastfeeding. There's issues about, her passing in her inner pants, her stools. She's bedwetting. At the same time, she's controlling the environment. She's trying not to drink milk, but she can't help it. So I felt there were strong infancy and toddler issues in her. There were strong issues of, she can control if she's in the mall, but at home, she just doesn't want to control. She controls the environment. So there's infancy and toddler issues coming very strongly. So we see in this aerial and adolescent, aerial falls in the 7th column, adolescent, and if you see early childhood, you see the black widow and tangleweb spiders, which come very strongly. So initially, when I started the treatment, I thought, Theridion fits because she's so sensitive to loud noise. So I gave her Theridion very repeatedly. I was almost every weekly, then later once in 15 days. For 3-4 months, I continued. But I got no results at all with Theridion. And I said, again on review, I felt, no, she falls in the spider. And then which spider? And then this complaint of chest pain. Very often, my heart is paining, my chest is paining, and she'll show her chest. And the parents used to be so worried. Then in our previous study of Latrodectus Hasseltii, we saw that Latrodectus Mactans has a lot of affinity towards the heart and chest. So I gave her Latrodectus Mactans 201 dose. And believe me, within no time, all her respiratory issues got settled. I had to repeat it once in 15 days, almost for 3-4 months, but she's so much in control where her respiratory, this is 1 year where she never got into any respiratory issues. Her breastfeeding has stopped. Now no longer pampers. She has a proper control over her bowel movements, and she's more, of her age. So this is where I felt that Latrodectus Mactans really did wonders in her case. So now I invite Dr. Anita Bajaj to share her case, which is equally interesting, but of an adult.
I will share my screen. Friends, sometimes when we prescribe the medicine, we hardly know anything, We are not that aware. It is out of desperateness that you are searching for some remedies, close coming remedies, and then you prescribe. But you become clear about the reasoning when somebody else is sharing a case or somebody else is presenting the understanding of the remedy. So this is such case, it was almost, not in my conscious mind also. But when Kushala shared her case in our group, then I could correlate this case. So this girl she's 20 years old. She's a special child, like scholastically backward. But she's very vivacious, friendly, affectionate, interest in music, dance, tabla. She has very good language skills. She's Marathi but speaks English very well because she had English speaking tutors. And normal social quotient. She mixes very easily. She makes friends very easily, to the extent, in her school where she goes, other girls were not that mingling. But during vacation also, she would force her mother to take her to friends' place. And then she will take gifts for them. To the extent those people, those girls used to feel that she is, acting smart. She is bringing gifts for us and all that. But this girl is very pure at heart. But at the same time, like she likes to make friends. Even in lift, she will talk to different people. Mother is always scared that she talks to strangers also. So that way, very social. In the shop also, if in childhood when she used to go, she used to pick up things and she used to bring it home. Then mother had to go and return it. So that way, like that discrimination was not there in her. She when she comes to clinic also, she will greet me very nicely with a smile. How you are? She will touch my feet, so, with a very good warm smile. So she's quite affectionate also. And her scholastic backwardness was more related to maths, and very attractive. And she's very fond of dressing, doing makeup, wearing jewelry. And she is attracted to the opposite sex. So she has one elder sister. So whenever her elder sister's male friends came home, or they met her on the way and they talked, she would always be interested in them and she would look at them. She's also interested in porn. So she would watch porn on laptop because she's taught computers. So she will find a way to, even if there are locks and all, she will find a way and go to search such websites and she will start watching porn. And at that time, she's not even aware like who is around her. In front of her brother-in-law also she would watch, or in front of her father also she would watch. So that time she was not realizing. She's 20 years old. Still, she did not realize that this is something, which is to be done in privacy. And like even if she was told not to do it, she would do it repeatedly. She would say sorry and then do it repeatedly. And she would become violent also if, if she was stopped from doing such things. She had impulse control disorder in the way like she wanted certain things like pizza or some eatables, chocolates or something. And if mother did not give her, then she would really become very aggressive and she would hit her, slap her hard. And then immediately, like if mother also slapped her back, or mother shouted at her, and immediately she would, apologize. She will hug her, she will kiss her, and she will feel bad that she did that. But then she was not able to control this behavior with her sister also. And whenever like she told her not to do something or she contradicted her, she would go and slap her. So this hitting thing, it was becoming very repetitive. And at the same time, whenever like she would immediately calm down and she would, say sorry. And whenever mother complained to me about her behavior, she would apologize to me also, and she would promise me that I'm not going to repeat it. I will not do it again. She would feel very bad, like very expressive. So she will express that remorse also on her face. That thing was there. And yeah. So on the basis of all these, I had given her many medicines like anger with quick repentance. I had given her spongia, and from her vivacious personality, extrovert. So I had given her spongia. Then I gave her crocus sativus, which also has anger alternating with quick repentance. But like it used to be under control, but then in such behavior issues, it is very difficult to even conclude about the remedy response. Then at a point, like when this hitting business was not coming under control, and when her this watching porn was not coming under control, I considered tarantula. And she also has interest in she also has interest in dance and music. So she listens to songs all the time, all peppy songs. She would dance. She had learned dance there is a dancer who, a choreographer who conducts classes for special kids. So her mother used to make it a point that every time, even if she had to stand in queue, she would take admission for her. And she had even performed on stage. So she was very good at dancing. And she also learned to play tabla. So she was quite musically inclined. So that was one of the reasons for me to consider tarantula in this case. See, unfortunately for us, spider means tarantula. We don't know many spiders. So that was a mistake even I did. So I gave her tarantula. Now, recently what happened, just 1.5 years back, she was diagnosed to have a heart condition. They had gone for some medical checkup and she was detected to have aortic stenosis. And that time her mother said ki she was told when this girl was born, from her facial features and all, doctors had told her that she has Wilson syndrome. So what is Wilson syndrome? Wilson syndrome, Williams syndrome, where the personality is, they are backward, scholastically backward, but at the same time, they are very friendly personalities. They have impulse control. They have desire to please. And, they are quite vulnerable. And they are very helping individual, emotional individual who understand and avoid potentially dangerous situations. Like they get into the dangerous situations being vulnerable. So mother has to always keep a watch that she should not talk to strangers. She should not get, manipulated by them or something. So she has to always keep a watch. So in the faces also, if it has a typical feature, wide lips, wide mouth. So corner to corner smile. It's a very smiling face. Like Down syndrome, even these features are very prominent, they are like fish-like mouth. Then they have typical eyes also. And they also have interest in music. So the mother was told when she was born, she was small, that time also she was told that you have to keep a watch on her heart because she may have developed congenital heart and she might have developed some heart issues because heart issues are very common in Williams syndrome. There are certain endocrine problems also related to that, but fortunately this patient doesn't have. So on echocardiogram, it was detected and then she had to undergo aortic stenosis surgery. She was detected to have aortic stenosis, which was asymptomatic, only diagnosed on echocardiogram. So that time, tarantula also was not, giving that much response. So considering the whole totality, what I understood is animal characteristics are there from animal energy, which is vivacity, sexuality. And this sexuality is uninhibited because she is watching porn in front of anybody. Like she's not realizing what she is doing. Then there is attractiveness. She wants to be attractive. And she's quite instinctive. And because impulsiveness is there. And not much developed. And she wants immediate gratification. That is the reason when she is hitting her mother and all, because whenever she wants something and she is not given, she becomes very aggressive. So considering all these, interest in music and dance also, I came to spider. I gave her tarantula. But after this heart disease was diagnosed, then it struck me that if I have to change, she also had ear infections, recurrent ear infections, which are also very common in Wilson syndrome. And it is also, Williams syndrome. And because of her ear infections, also I was thinking of, Theridion, because Theridion has ear pathologies. But then when I saw this congenital heart disease was more prominent, so that time it came to my mind that I should think of Latrodectus Mactans. I gave her Latrodectus Mactans. She was on 200 weekly, and then she's still on 200 weekly only. And overall her behavior has changed, and overall her grasping power has changed. And she also appeared in last 6 months. She has also appeared for her 10th exam. And now she is preparing for her 11th and 12th exam together. So mother feels her grasping power has improved, her impulsivity has improved, and she's quite focused in her studies. And mother has made her very busy in her routine. So her attraction towards porn also has reduced. So that may be because mother is also sitting at home now. She is retired. Earlier she was working. Now she is retired. So she is, spending more time with her, taking her for walks, making her do exercises, and studying with her. So with Latrodectus Mactans, that change has definitely come. I will invite Nirupama to talk about PEM aspect and Latrodectus Mactans as a remedy. Stop share.
Thank you, Anita.
Yes.
So, friends, PM aspect we have already covered in Latrodectus Hasseltii. We have already taken 2 spiders, where we have taken detailed theme of spider, and then we have studied detailed in Theridion and Latrodectus Hasseltii. So today focus will be more on Latrodectus Mactans. So if you see both the cases where spider theme was very evident, with the spider theme, when heart indication came, the remedy got clear. Like first case, Kushala was giving Theridion, which belongs to the same family. In Theridion family, there are these 3 remedies are there: Theridion, Latrodectus Hasseltii, and Mactans. So she was giving Theridion, but it was not helping. And then when there was a strong family history of heart illness, then she could give some value to the pain which patient was continuously showing in the heart region. And then she could select the medicine. Similarly, if you see in Anita's case also, the spider theme was very, very clear. But then we could not got any indication to select Latrodectus Mactans till she was diagnosed with aortic stenosis. Yeah. So if we study this remedy more in details, so you see, this is neurotoxin. Neurotoxin where there is a lot of nerve pain, and along with that, most of the neurotoxin, you see a lot of anxiety coming in. So this spider poison typically has effects at 3 regions: heart, where it produces typical symptoms of angina pectoris. Then it has effect on blood coagulation, where blood becomes very thin and watery, and it causes a lot of spasms. So after bite, this spasm remains for several days. That is what is the observation, and person gets really very restless with the pain. So cardiac pain is something indicating symptom for the Latrodectus Mactans. So along with any cardiac symptom, like if there is any pain, person really becomes extremely anxious and it develops a lot of fear of death. So highly intense emotions develop along with the any cardiac problem. So they respond very exaggerated, extremely fearful. They scream in pain and they feel as if they're losing breath and they will die. That much was the fear and anxiety. Most of the time, you see, there are the left-sided complaints, and many times periodicity is very marked. So typically, you see anxiety, heart off, and fear, death off. These are the very 2 characteristic symptoms with the precordial pain. And see that precordial pain, the characteristic of the Mactans will be spasms, spasmodic pain in the precordia, which travels to the shoulder and then it goes down in the hand. Typically, we feel it's angina pectoris, right? That is the picture. But the pain lasts for long and person feels numb and cold. Sometimes they even feel my hand is paralyzed. That is very typical of spider pain: numbness, coldness, and paralyzed feeling. Then all cardiac issues, You think about any heart issue, it's there in Mactans, like cardiac fibrillation, cardiac failure, ischemic heart disease, myocardial infarct, valvular diseases. So all are covered here. And along with that, spasm of esophagus and spasm of the jaw is also very characteristic. You see chewing type of symptoms sometimes, along with some other complaints. You can think of Mactans that time. And the coldness of whole body, skin as cold as marble. Hmm? And you see dreams of flying. So this speaks about the Latrodectus Mactans in details. Uh, Anything else you want to add? Kushala, Anita?
Yeah, I just forgot to mention that being a heart remedy, these patients are very emotional. Like Nirupama also has mentioned intense emotions. So in my case also, I saw this girl is very loving, very affectionate. And after throwing tantrum or after, hitting also, she would immediately realize and she would immediately feel bad about it. And she would go and hug her mother, kiss her mother. So being a heart remedy, you should, if you get a spider remedy with emotions, and you don't see any negative emotions in these, like jealousy and all that is not there. So that was one of the things which made me feel that it is not very well developed. And heart affection, it may be structural, organic, or it may be functional, or it may heart may be normal, but the chest precordium region per se is the characteristic location. So in Kushala's case, there is no heart pathology as such, but patient complains of chest pain, which may be functional also. So this thing has to be kept in mind, that you don't need to prescribe, like don't need cardiac organic pathology or structural pathology to prescribe Latrodectus Mactans.
True.
That's all from my side.
So friends, we have already shared 2 videos with you all, like Theridion and Latrodectus Hasseltii. Go through these 2 videos to get complete idea of spider, and then you study our this remedy too, Latrodectus Mactans. And do share, subscribe, and send your comments in comment box. Thank you.
Thank you.
Thank you.
You.